Hi, my name is Rachael Olson. I began my nursing career as a licensed vocational nurse and started working on telemetry at a local hospital. I knew that I wanted to further my career, so I quickly returned to school to obtain my associate's degree in nursing. I currently have my associate's degree in nursing and I am working towards obtaining my bachelor's of science in nursing degree. Since getting my associate's in nursing degree, I have been in the emergency department and I plan to stay there as I continue my education. Today I'm going to share with you some of what I have learned throughout the RN to BSN track, as well as my nursing career goals over the next 5 years. There are 5 classes of which I'm going to discuss with you and how they enhanced my thought process in regards to humanity and society, lifespan health continuum, evidence-based practice and clinical reasoning, patient-centered care, and lastly, professional roles. Life, humanity, and society. This class is represented by care of communities. It taught me to assess diverse and global community populations to ensure adequate disease prevention and implementation of holistic care to promote health and well-being. The assignment that I chose to share with you all was the CBSL Civic Pride and Diversity Initiative assignment. In doing this assignment, I was astounded at all that I had learned throughout the process of gathering and collecting information. I discussed an organization called Be the Match, a bone marrow donor organization. It's simple. Swab the inside of your cheek to become a donor. It doesn't matter your race, ethnicity, or gender. Anyone can do it and in the process could save another life in need. During this course, I also completed a windshield survey assignment on the county that I lived in at the time. It was very educational to me to have to dig into the history of this county to discover the statistics and the changes that have happened throughout the years. Some of those changes making it difficult to go on, and others making it better than it ever was. Lifespan Health Continuum. I chose 2 classes to represent this learning objective. Care of patients with compromised health states and comprehensive holistic health assessments. These 2 classes taught me the care of patients across the lifespan, with the focus being on multidimensional needs of those in a compromised state to promote health and prevention of other diseases. The assignment I chose was the patient memoir assignment to discuss. We chose book selections. Mine was Wasted by Mara Hornbacher. I chose this because it was overeating disorders, and I had a close friend in which I witnessed her eating disorder and how it changed her forever. I met with my dear friend, and we discussed some of her trials that are as the same of those in the book. I also help her to get in touch with others that have gone through the same trials, and we often get to talk with each other on how well this has helped her to stay on the right track in life. The other assignments that I chose to discuss are the shadow health assignments. We use these assignments to help us as patients with multiple health compromises and to aid us in learning about each body system and how it works. Evidence-based practice and clinical reasoning. This is represented by evidence-based practice and inquiry, as well as nursing theories and online education. These classes taught me that clinical reasoning and judgments in nursing practice use critical thinking, nursing process, and evidence-based practice. I chose the group quantitative paper as the assignment to discuss. The paper was an objective measurement and over statistical facts. I worked with a group of classmates to compile a research paper over applications that nursing students use during their courses of nursing school. Also, in one of the classes, we were given focus insight questions with different scenarios with several questions in regards to Roy's adaptation model and Newman's system model and how each patient condition was affected. Patient-client-centered care. This is represented by the Nursing Leadership and Management in Healthcare Systems class. The learning objective of this was that we should always employ safe and effective care to our patients no matter their ethnicity or race. Interprofessional and intraprofessional healthcare team members, such as nurses, doctors, residents, pharmacy, and all other members with direct care of patients, should work together to make sure that our patients are the center of their care and receive safe and efficient care. I chose the clinical application assignment to discuss. I wrote about the prevention of central line-associated bloodstream infections, also known as CLABSI. I discussed what each healthcare team member needed to do to avoid CLABSI. Each healthcare team member has their own role in decreasing the chance of infection in patients, such as the nurses using the scrub the hub method, cleaning for 15 seconds, and letting it dry for 15 seconds prior to medication administration in a central line. Lastly, I'll discuss professional roles. This was represented by two classes, Nursing Theories and Online Education, and Nursing Leadership and Management in Healthcare System. During these classes, I learned that as leaders, we should exhibit effective communication and community service while maintaining professional integrity. We also learned how to serve multi-dimensional roles and practice within legal and ethical guidelines. One of the assignments that I chose was the Differentiated Essential Competencies paper. In this assignment, I discussed the different roles between an associate's degree nurse and a bachelor's degree nurse. Although the two take the same licensure exam, there are differences in their roles as nurses. Another assignment that I chose for this learning objective was the clinical application assignment. It allowed me to learn more about ways to prevent infection in our patients and what roles the healthcare members took. Both of these assignments opened my eyes to a whole new avenue and what role I fall under as a registered nurse. As for my 5-year plan, I will soon graduate with my Bachelor's of Science in Nursing degree. I plan to become CEN certified because this exam will allow me to prove my skills as an emergency room nurse. Once I have obtained my CEN, I plan to join the trauma team in the emergency center that I currently work at. I hope to be accepted to the nurse practitioner program, where my focus will be in pediatric emergency medicine. And lastly, I plan to obtain a job as a nurse practitioner in a level 1 pediatric trauma center. Thank you.